Can I start by saying I was asked a few weeks ago to give a presentation on leadership at Parliament House for the Indigenous Youth Parliament that they run, and I kind of thought, I'm not a leader. And then I thought, and then with today I thought, I'm not a researcher, but I'm both. I know I have been, but a very, very unconventional kind of track there. And so I want to share with you a little bit about what I've done and some of the lessons I've learned along the way, and why I got into research and the sorts of things I've done. I'm a descendant of the Noongar people, who are one of the three tribes that come from the Moreton Bay region of Queensland, Stradbroke Island, which some of you might know, which is a beautiful part of the world, and my family still live on the island. So that's me. But so, you know, I thought, I've still got both parents, I've still got my brothers and sisters. I'm in the fortunate situation, particularly for an Aboriginal family, of having all of my family still very close to. I'm married, I've got 3 sons, I've always worked, and I consider myself a colleague and friend to many. But I mean, working in this space, you're always a community member and you can never leave that behind, and sometimes it can be incredibly demanding. I worked in government for quite some time, and I've worked in academia, I've worked as a consultant, I've worked with Aboriginal Community Controlled Services, and I've served on a number of committees. But I just wanted to go back, because for me the opportunity came through my education, and it was an opportunity that my mum and dad didn't get. AB Study supported me, and I got to go to Leeward Hill College, which was a very good college in Brisbane. And I consider myself as a fairly quiet kid who went under the radar pretty much. And when I went into year 12, my grandmother died very suddenly on Stradbroke Island, and we were very close. Went to her funeral, came back and had to go straight on a school camp. And I got elected school captain. And it wasn't, I just didn't see it coming. I don't think anybody did. And it wasn't the kind of script that had been written for the school at the time. This kind of Aboriginal girl, daughter of a wharfie, you know, it wasn't the school image. I think the principal at the time had incredible insight into how to allow me to take on that leadership position, but protect me, not in a patronising way, but she knew what I needed to be afraid of, and I didn't. And she passed away a couple of weeks ago, but she was probably the person who shaped me more than anybody in terms of my leadership capability, because I wasn't ready for that. And she's made a point of following me throughout my career, and I've really valued that. But I finished year 12, and AB Study were very keen on the fact that an Aboriginal person had finished year 12, and I had to go to university and I had to do social work, because that's what was needed to fix Aboriginal people. I didn't want to do social work. I got into university on my own merit. I went to UQ, which is where I now work, and I did social work because I was told I needed to. So choice wasn't really something I had, and I was told that I was one of 2 Aboriginal students at the university. So it wasn't an institution that had thought much about it. And I learnt very quickly that Aboriginal people weren't ready to be in university, and that certain professions didn't think they belonged there. And for the first time in my life I failed, and I didn't fail because of my ability, I failed because I just didn't fit, and I just ran away. And you know, it was really difficult at the time, but it was something I needed to do to, one, fight, because when you're ready to fight you can, you know. And I went away and I worked in the Australian government. That was probably worse, because it was the Department of Aboriginal Affairs. It had just been set up, and we had a lot of expats from PNG that had come back, and I was one of the very few Aboriginal people in a proper job in the department. Most of the Aboriginal, well, what was regarded as a proper job, most of the Aboriginal people were in clerical assistant type roles, unskilled, untrained. And so I was in this difficult space of being an Aboriginal person who wasn't with all the other Aboriginal people in the department. I was too good for them. I was up with the senior staff. So it was really difficult, and I was very young. But I got married and I had my first couple of kids. I did it the hard way because I went back to university, finished a degree, did a dip ed and thought I want to teach. And I worked in an Aboriginal college for a number of years, teaching in Aboriginal post-secondary courses really. But then an opportunity came along for me to lead something that I would never have ever gone after. And one of our strong community leaders, who's now deceased, but Mick Miller, who was in North Queensland, some of you, if you're old enough, he did a national review of Aboriginal education and training, employment and training in about 1985, and he really did lead a number of reforms. And he lobbied very hard for, you know, a sandstone university like the University of Queensland to offer a training program for Aboriginal health workers who were unstructured in a career sense, not professionalised, not covered by award structures. And so this position in the Faculty of Medicine at the University of Queensland was advertised for someone to come and lead the development of the curriculum. And they wanted an Aboriginal person, they wanted somebody with educational experience, and they also advertised the head of program. So I was interviewed for and won the curriculum position. I often say to people, if I knew anything about medicine, and the Faculty of Medicine at UQ, there's no way I would have applied for that job. But the day I started, the person who was appointed to head the program, who some of you might remember, was Dr. Sally Gould, who is a very prominent Aboriginal nurse who was a Senior Australian of the Year a few years ago. She withdrew on the day that I started, so she decided not to take the position, and they said, "You're it. You've got to lead this thing." And I knew very little about health. I knew nothing about the Faculty of Medicine, and I had to develop the curriculum, and it really was a lot of educational research that I had to do to develop this curriculum in health and get it through a faculty board. After 12 months of developing it, and the only way I survived that was knowing what I didn't know and getting people around me to be part of a great team, and I owe, you know, my entire career to some of those people. But when we had to take the curriculum to the faculty board for approval, I thought a board meeting would be something sitting round a table, and I walked into this lecture theatre with about 120 people in it, and I presented the proposal, and with respect, you know, this is the medical school, there were about 99% of them were old grey men in suits, you know, sorry Pat, and there were one or two, sorry, but you know, so I gave the presentation, and someone who was clearly a physician, because he arrived at the meeting with his long coat and his stethoscope, and he just went to town on me. And you know, we were going to be training barefoot doctors and bush nurses and bringing down the quality of the faculty, and then the AMA joined in, and I just thought, well, I'll be looking for a job tomorrow, but you know, this went on for a long time, this absolute bagging of what I'd done. And then they took it to the vote, and everybody in the room voted for it, with the exception of 2 people. And I just thought, later I thought, why didn't one person just say, this is a great initiative? But as someone said to me recently, had they have done that, it might have started a fight, you know? They may have been getting some air. It was that sort of, you don't give oxygen to this, you just let it die. So I don't know, but I ran what was, I regard as a very successful, first of its kind in Australia, if not internationally. It was reviewed, and we put about 100 Aboriginal students through this degree. Some of them are doctors now, some have got PhDs, so it really was a great pipeline. Unfortunately, decisions were made and they were linked to resources, and that sent me on a different path, because I've always been a very much a team player, but I believe in what I believe in, and if philosophically I can't do something, I just can't do it in this space. And so I did leave for a while, and that was good for me because I reflected on the work I'd done, and in that time I'd put a lot of bushfires out because the research effort started to grow in the faculty, and we didn't have the capacity, and nor did many of the people who were doing the research. So I'm just going to talk about a couple of these. So I started to get really interested in health policy. I saw a lot of areas where I thought Aboriginal health services were not being treated equitably with mainstream services. I saw the workforce issues, the capacity issues, a whole range of things. I was appointed in 2001 the chair of the National Indigenous Australian Sexual Health Committee, and I travelled the country developing the policy and doing reviews of it, and I regarded that as serious policy research, talking to community members about very sensitive issues. And some of you would have heard of the Bringing Them Home report, which was the report of the stolen generation. And when I did my work around the country for the sexual health policy, there was an overwhelming outpouring of child sexual abuse as being a major priority, and people wanting us to lead something. And I made many attempts as a ministerially appointed chair for that to happen, and it fell on deaf ears. But I was still in that job when the Northern Territory intervention was announced, and that was as a result of a report on child sexual abuse. So you kind of reflect on that and think, what could I have done differently? What should I have done differently? And sometimes you have to accept that political decisions are going to be made for a whole range of reasons outside of your control. But I also got involved with NHMRC, and I guess I didn't consider myself a strong researcher. I'd done a lot of different types of projects in communities, but what I think I hope I've done with NHMRC is help develop their pathway into Aboriginal and Torres Strait Islander research and a policy framework for operating in this space, because it's a relatively new space for the organisation, but I know the commitment's there. In 2008, I was Deputy Chair of the Prime Minister's Science, Engineering and Innovation Committee's report that was submitted on fetal, maternal and postnatal health amongst Aboriginal and Torres Strait Islander peoples, and that gave me the opportunity to hear the evidence all around the country and to have a fairly significant impact on the policy and funding direction in that space. But it also made me step up, and I don't know how many times I had to practice the presentation in the cabinet room before the day. And I'd given lots of presentations, but the way I felt like hardwired to do something so properly. I thought, I'm going to blow this because I'm not very good. I just need to go in and talk. And anyway, it was an experience. I also was commissioned by the department to do a big part of the interdepartmental review of Indigenous primary health care in 2002-03, and that gave me the opportunity to really get some health services research under my belt, and led me to doing a number of commissioned reports that were some very, very sensitive, that'll never see the light of day, and that's been a problem for me in terms of justifying my existence at times. But I think now, a decade later, I'm getting close to the point of seeing some radical reform and radical release of the findings of a decade worth of work, which I'll talk to in a moment, and that's largely been around governance and some fundamental changes that have to occur. All the evidence is there, but I'm going to talk to translational issues because I think they're really important in this space. So I want to just raise a few issues. One, and this was reflecting largely on the PIMSEC report that I was involved in, because that was a fairly intensive 2-year project. And one of the things that gets talked about a lot in Aboriginal and Torres Strait Islander communities is the prevalence of and the existence of fetal alcohol spectrum disorders. But the reality is we don't actually know. We know that there's evidence around alcohol as a risk factor and alcohol consumption in pregnancy, but certainly on the basis of the work we did, that there's been very little done. I think there's one Western Australian study, but on prevalence and on interventions and follow-up of kids. And so government and programs want to fund interventions or programmatic activity without understanding the size of the problem, whether this intervention actually works or not. So that's led to some fairly high priority research needs within NHMRC that we've discussed a lot. We also, in that process, gave the example of an intervention that had been in practice this was in the Northern Territory for a long time, where the high prevalence of scabies. The belief was that dogs were the problem, and there were a whole lot of, that poor dog's not very well, but there were a whole lot of programs in place to cull the dogs and to deal with them. And then a research at Menzies found that the scabies mite on the dogs was different to the one on humans, for which they were on which they were basing the intervention. So that was another lesson for me. We also found in that process that there'd been a number of mainstream, a number of research projects that had led to changes in mainstream health practice. This was in the maternal and child health space, but hadn't necessarily been routinely applied in Aboriginal and Torres Strait Islander health. And things like folate, yes, but and the discussions around epigenetics are happening now, and but some of the health service issues around midwife-led kind of programs, home birthing, some that have had impacts on birthing approaches in Australia generally, just haven't even been thought of. And I know, sitting at NHMRC, we've had lots of discussions about things like hospital-based research, that very rarely do we see projects in hospitals that say, yes, there'll be Aboriginal and Torres Strait Islander people involved in this project, or that even consider whether there might be some merit in. Yet the data shows us that there are a whole range of conditions for which Aboriginal and Torres Strait Islander people are much more likely to be hospitalised, and for longer periods, and with multiple problems and all of that. So, so the application of mainstream evidence to Indigenous populations came out there. And this is one that gets to the heart of what I've probably been doing for 20 years, where the research results tell a story that people don't want to hear. And very often some of the research I've done has been, people have wanted it to validate a position or legitimise the way they think. And because I've done a fair bit of health services work, probably, these are recent newspaper headlines, and I don't have to read them to you, but clearly we've seen organisations fall over, we've seen scandals in services, we've seen growing evidence that sick services are producing sick populations and vice versa, and yet what are we doing about it? And it gets to the heart of what we mean about Aboriginal community control and having to be able to discuss that, but it also gets to the heart of the sustainability of Aboriginal health services, and a debate and discussion that people sometimes just find all too sensitive. And I guess there's some other challenges that I've come across, done some fairly contentious sort of research that people might not want to know about, or might be fairly difficult to implement. I did a big project in the 90s, which was in the early days of HIV, where and its risk amongst Indigenous injecting drug users, and we trained a lot of injecting drug users to be the interviewers, the peer interviewers for that project, and there's no way we could have done that project without them. But their place in a faculty of medicine is a bit hard to imagine, and you ride some difficult times with some of these projects. Another project that one of my honours students did, that because of the high number of SIDS, or what were classed as SIDS deaths in Aboriginal kids in Queensland, raised a whole lot of issues about the quality of the autopsies, and in fact the findings were probably what people didn't want to hear. But those sorts of really sensitive in terms of some of the ethical issues, sensitive in terms of some of the potential findings. I'm just giving you a couple of examples. I'd be happy to elaborate on these. I think for myself, I'm getting a bit old now and I don't have the same track record that some researchers would expect, but I've done a lot of policy and health services research that hasn't always been valued in the academic arena. And I can remember once a former boss saying to me, I want you to stop doing this policy stuff and do some real research. And you know, I'd been around for a long time, and what I wanted to do was change what I could see was fundamentally a problem in the way services are being delivered and the way, you know, we're not short on policies in Aboriginal health. We get a new policy every time someone blinks, but implementing them and evaluating them and terminating them if they're not working isn't something we've seen anything. And you know, let's face it, that's what influences resource allocation. And if we haven't got that right, let's radically rethink it. The other thing, you know, I'll give a quick example of Warrabinda because this goes to the heart of research relationships and how you can start a small project and all of a sudden it becomes something completely different. And they had an outbreak of strongyloides up there and they wanted us to do something about it, and they were absolutely convinced that it was their water supply, that there were problems with it. And I had 14 students doing environmental health at the time up there in the field for 3 weeks in a really and 10 kids had been airlifted to hospital, so it was quite a serious outbreak. And I got up there on about day 4 and I had these students who were really anxious, angry. What are we doing here? No one wants to talk about worms. Everybody wants to talk about drugs and alcohol and violence and, you know. And I said, well, it's a problem. There's 10 kids in hospital. If, you know, you've got to, but part of your challenge is, if it's not seen as a problem to start with, raising that awareness. But anyway, 3 weeks later I went back to, and they had stool samples lined up from one end of our makeshift school to the other. They had community mobilised, and they'd, you know, the council absolutely, this is the Aboriginal Council, absolutely embraced that project because they were involved in it right through the whole thing. They realised it actually wasn't the quality of the water, it was their own practices. You know, they had all the evidence, there were a whole range of things that needed to change, and it did lead to a major council reform package, but what it also led to was a major injury project because of the issues of drug and alcohol. And when we did the injury project, we found this was a community that had an injury rate the previous year of 168%. And this was something that no one would want to hear about their own community. It portrays it as a violent community. And there's no way we could have done that work if we were researchers coming in from the University of Queensland to see, you know, what your injuries are like and what rate. This was a community-based project, owned and driven entirely by the community. And they closed their canteen. They had a very strict policy with their footballers, and they became the role models in the community, and as leaders they absolutely took on that. So I guess I'm just giving you a few examples of the things. I was asked also to consider the issue of adversity, and there's been plenty of it in my space, but these are 2 examples where I've had a leadership role. Have any of you heard about the stolen wages issue in Aboriginal communities? Yeah, I mean, it's not, well, it is health related, probably more your area than anyone's, Pat, but the fight for stolen wages has gone on in Queensland for a long time. The Queensland government started to the reparations process about a decade ago, I think, or thereabouts, and they've had 2 rounds of reparations. But the eligibility criteria mean that there's it's considerably narrow. A lot of people are now deceased. The being able to prove that your wages were stolen, which is a terrible thing to have to do. So it's really highly contentious. But after the 2 rounds of reparations, there's $34 million sitting in that trust account where people's wages were held. And so that was transferred to a trust account for a new foundation for Aboriginal kids for scholarships in education. And I was appointed chair of that foundation 3 years ago when the trust deed was signed, and I had to walk through protests of my own people and people who are valued colleagues and friends and who just thought that I was selling them short. And it was really difficult, but I believed so much in education, and I'd had the privilege of an education myself, and it is. Fiona's absolutely right. For me, it was a great privilege, and I see what it's done for me, for my kids. They're all at university now, and we've broken the cycle that needs to be broken in so many communities. Having said that, we've now funded about 880 scholarships for Aboriginal and Torres Strait Islander kids in years 11 and 12. It's just been absolutely embraced, and I think that'll be over 1,000 very shortly. I think that people have realised the unintended impact of this is that every school that's involved will never let this story be lost. It's built into the curriculum, it's built into their reconciliation events, it's, you know, and we can't spend that $34 million. We've got to grow it. So people didn't realise that. I think they thought their stolen wages were going to be spent, but there's a bit of misinformation. The other highly contentious issue, of course, has been the Northern Territory intervention, and as I said, I was chair of the National Indigenous Sexual Health Committee at the time. I had a lot of questions, that some of which were answered and some of which weren't, and I have my views about the Northern Territory intervention and the way it's been rolled out. It's a really difficult one, but because I believe the only people who can really comment from a lived experience of it are those on the ground in the Territory and it polarises people. There's some communities that are very for it, there are some that are very against it, but that happened not under my leadership, but while I was leading a committee that was advising on sexual health. This is the last thing I just want to talk briefly to. I mentioned that I'm getting close to, I hope, seeing some results from a decade or so of health services and health policy type research. And in my own backyard in Brisbane, so I'd done a lot of national work. About 3 years ago, they asked me to come and help them, and they were ready to take some leadership in, and this is what I regard as true leadership in Aboriginal affairs, and a few very bright young guys. As you can see, Brisbane's now got the biggest population in Australia of Aboriginal and Torres Strait Islander people. So our catchment area, Greater Brisbane area, has got almost 10% of the entire Indigenous population. This isn't the whole population, I've just listed the major clusters around the country to compare us. But when the COAG, you would have all heard of the Close the Gap initiative too, I imagine. When that was announced, if you read the fine print, it didn't talk at all about urban Aboriginal people. It's this myth that you have to go remote to find sickness, and yet, you know, there's these extraordinary, in fact, about more than 50% of the Aboriginal population live in urban areas. About 75% live in what's called non-remote. So, you know, it's by far the biggest. And the 4 Aboriginal medical services in southeast Queensland decided to come together, reform themselves into a new model of governance, a response to the COAG Close the Gap initiatives. And these are the 4 services. A big flash building for the one in Brisbane, and if you know southeast Queensland, there's one on the Gold Coast, one. This is Stradbroke Island, where my family, and that's Ipswich. But And so we developed a new model of service delivery that's an integrated regional model largely for chronic disease prevention with all the money, and it's a whole lot of smoking, care coordination, urban specialist outreach program, and the governance has also reformed. So whilst it's still what we would call a community controlled model because it's got Aboriginal, the 4 services own it. There's people like Michael Good, who'd be known to all of you, on the board of the Institute, Dr. Noel Heyman, who many of you would know too, who's a very high profile Aboriginal doctor. So the whole governance of Aboriginal health has been reformed in this model, and I can talk to some of the results if you're interested, but they've got incredibly impressive data to show increases in service access, management plans, health assessments, whole lot of community engagement activities across the region. But I set it up and I was sort of seconded across for 3 years, the first 2 years, and they appointed a permanent CEO last year who really was the visionary behind it all too. But I think when I handed over, their budget was about 2 million and they, a dozen or so staff. Last I heard a week or two ago, it's up around 20 million and 100 plus staff. So it's an extraordinarily good news story in my mind. Just the importance of engagement. These were one of the many meetings we facilitated along the way with that project. But I just want to finish by saying it was time, like with that process, they grabbed me to lead it and to be someone who was sort of a bit new to the sector, who had an academic appointment, who could talk the talk when it was needed. But I also knew when I had to step out of it, and I think it's really important to know your place in a process and when it's easy to own something. And the degree I ran in the 90s, which as I said, I was brought in and I was a lone person. I was the only person for the first 12 months who was actually employed on that project. It did become known as Cindy's degree. People around the country would say, oh, you're going to Queensland to do Cindy's degree. And that wasn't the way I sold it, by the way, but it was just and I'm not so sure that was a good thing. It wasn't, I know that. That's how the community talk that way too, because that means something. It's not UQ don't mean anything, But I took a year off to finish my doctorate. And I had fantastic staff and they could carry it, they were ready to, but something happened in that time and it had nothing to do with the staff. It was just that I know that the leadership both in and out needed to be fixed up to sustain it, and something happened. So I may have dropped the ball, it may have happened anyway, I don't know. But what I do know is that I've always valued the team around me. They're incredibly important to me. When I was running the program and the head of the head of a centre that I reported to, he said to my staff one day, because I did get on very well with them, he said, if you wanted to sack the cook, would you ask Cindy Shannon to do it? And he said, of course you wouldn't, like she couldn't sack her. And I sort of thought, that's a bit mean, I can make the hard decisions. But last week one of my staff said to me, you're very intimidating, Cindy. And I was really taken aback because I said, you're kidding me. She said, no, you're really scary. And I said, you've got to be kidding. I said, I've never had anybody say that to me before. But, I guess, last year I got appointed as a Pro-Vice-Chancellor for Indigenous Education at the University of Queensland, which did come out of left field. And I didn't see that coming, but it was a fantastic opportunity for me. It's the first time that position's ever been, it was created as a new position, and I'm the first occupant of it. And for someone who was one of the very early Indigenous students at that institution who's kind of gone through a range of cycles there. It's a great opportunity, and I always say you can't sit on the sidelines and criticise if you're not prepared to be part of the solution. So that's my aim now. So thank you very much.